HIV, Human Immunodeficiency Virus, is a virus that attacks the immune system, specifically the CD4 cells, T cells, which help the immune system fight off infections. If left untreated, HIV can lead to the disease AIDS, acquired immunodeficiency syndrome. Unlike some other viruses, the human body cannot get rid of HIV completely, so once someone has HIV, they have it for life. SINGs of HIV, Human Immunodeficiency Virus. Infection can produce a wide range of symptoms, and it's important to note that the progression of the disease varies from person to person. Some individuals may remain asymptomatic for many years, while others may experience symptoms earlier. It's important to differentiate between the signs of HIV infection and the symptoms of AIDS, acquired immunodeficiency syndrome, which is the advanced stage of HIV infection. Early symptoms of HIV, fever. One of the early symptoms is often a mild fever, usually within a few weeks after infection. Fatigue. Persistent fatigue and weakness may occur. Swollen lymph nodes. Lymph nodes, particularly in the neck, armpit, or groin, may become enlarged. Sore throat. A sore throat can be a symptom of the initial HIV infection. Rash. Some individuals may develop a rash, which can be itchy. Muscle and joint pain. Muscle and joint aches and pains may occur. Headache. Headaches, often severe, can be a symptom. Night sweats. Excessive sweating, particularly at night, may be present. Nausea and vomiting. Some people may experience nausea and vomiting. Diarrhea. Diarrhea can be a symptom, lasting for more than a week. It's important to note that these symptoms can also be associated with various other illnesses, and the presence of these symptoms alone does not necessarily indicate HIV infection. Advanced symptoms of HIV/AIDS. As HIV progresses to AIDS, more severe symptoms and complications may arise. These can include persistent diarrhea and weight loss. Chronic diarrhea and unexplained weight loss can occur. Opportunistic infections. HIV weakens the immune system, making individuals more susceptible to opportunistic infections, such as pneumonia, tuberculosis, and certain types of cancers. Neurological symptoms. Advanced HIV can affect the central nervous system, leading to neurological symptoms such as confusion, difficulty concentrating, and memory loss. Skin problems. Skin rashes, lesions, or discoloration may occur. Persistent cough and shortness of breath. Respiratory symptoms may become more pronounced. It's crucial for individuals who suspect they may have been exposed to HIV or are experiencing symptoms to seek medical attention promptly. Early diagnosis and treatment with antiretroviral therapy, ART, can help manage the virus and slow its progression. Regular testing, safe sex practices, and awareness are key components of HIV prevention. If you have concerns about HIV, it's recommended to consult with a healthcare professional for testing and guidance. Causes of AIDS. Acquired immunodeficiency syndrome, AIDS, is caused by infection with the Human Immunodeficiency Virus, HIV. HIV is a retrovirus that attacks the immune system, specifically the CD4 cells, T cells, which play a crucial role in the body's defense against infections. Here are the primary causes and modes of transmission for HIV, which can lead to the development of AIDS. Unprotected sexual intercourse. The most common mode of HIV transmission is through unprotected sexual intercourse with an infected partner. This includes vaginal, anal, or oral sex without the use of barrier methods such as condoms. Sharing needles or syringes. HIV can be transmitted through the sharing of needles or syringes contaminated with the blood of an infected person. This mode of transmission is common among injecting drug users. Mother-to-child transmission. HIV can be transmitted from an infected mother to her child during childbirth or breastfeeding. With proper medical care and interventions, the risk of transmission from mother to child can be significantly reduced. Blood transfusions and organ transplants. In the past, HIV transmission occurred through contaminated blood and blood products, as well as through organ transplants from infected donors. However, blood screening procedures have improved significantly, greatly reducing the risk of transmission through blood transfusions. Occupational exposure. Healthcare workers may be at risk of HIV infection through accidental needle stick injuries or exposure to infected blood. Invasive medical procedures. While the risk is low, there have been cases of HIV transmission through invasive medical procedures, such as the use of contaminated medical equipment. It's important to note that HIV is not transmitted through casual contact, such as hugging, kissing, or shaking hands, nor is it spread through air or water. Additionally, insect bites, sharing utensils, and contact with surfaces do not transmit the virus. Preventing the transmission of HIV involves practicing safe sex, using condoms consistently and correctly, avoiding sharing needles or syringes, and ensuring proper medical care and interventions during pregnancy to prevent mother-to-child transmission. Early detection of HIV, followed by appropriate medical care, can help manage the virus and prevent the progression to AIDS. Treatment of AIDS. While there is no cure for AIDS, acquired immunodeficiency syndrome, medical advancements have led to effective treatments that can control the progression of the disease and allow individuals with HIV, Human Immunodeficiency Virus, to lead longer and healthier lives. The primary form of treatment for HIV/AIDS is antiretroviral therapy, ART. Here are key aspects of the treatment. Antiretroviral therapy, ART. ART involves taking a combination of medications that target different stages of the HIV life cycle. These medications help lower the viral load in the body, maintain a healthy immune system, and slow down or prevent the progression of HIV to AIDS. ART does not cure HIV, but it can significantly improve the health and quality of life of individuals living with the virus. Timing of treatment. Early initiation of ART is crucial for better outcomes. Starting treatment as soon as possible after diagnosis helps preserve immune function and prevents further damage to the immune system. Adherence to medications. Strict adherence to the prescribed medication regimen is essential for the success of ART. Missing doses or not taking medications consistently can lead to the development of drug-resistant strains of the virus. Monitoring and follow-up. Regular monitoring of viral load, CD4 cell count, and other relevant markers is done to assess the effectiveness of treatment. Follow-up appointments with healthcare providers are important to adjust treatment as needed and address any side effects or complications. Prevention and management of opportunistic infections. Opportunistic infections, which take advantage of a weakened immune system, are a common concern in advanced HIV/AIDS. Prophylactic medications may be prescribed to prevent specific infections, and prompt treatment is crucial if infections occur. Supportive care, adequate nutrition, mental health support, and management of associated symptoms contribute to overall well-being. Supportive care helps individuals cope with the challenges of living with HIV/AIDS. Prevention of transmission. Individuals on effective IRT with undetectable viral loads are much less likely to transmit the virus to others. This concept is known as undetectable, untransmittable. UU. Encouraging safe sex practices and promoting awareness about HIV prevention are integral components of treatment. It's important for individuals living with HIV/AIDS to work closely with healthcare professionals to tailor treatment plans to their specific needs. The landscape of HIV/AIDS treatment continues to evolve, with ongoing research,